Hi everyone. I think we'll kick off. It's 10:32. Thanks to everyone who's tuned in for the launch of the Penrith City Health Snapshot. It's great to have you along. I can see a lot of familiar names in the attendees list. I'm Melissa McSeveny. I'm the Social Planning Coordinator at Penrith City Council, and we're today launching the Health Snapshot, which is now available on Council's website. Just some housekeeping before we start officially. So all the attendees today, as you're probably used to by now with the Zoom webinars, you're on viewing only, listen and view. So you won't be able to turn your camera on, but we can pass around the microphone if you raise your hand for questions, or you can use the Q&A function at any time and we'll get around to answering your questions. We're also recording the session, so this presentation will be on Western Sydney Community Forum's YouTube channel after this. I'll now play the Mayor's video to officially welcome everyone. Thanks.
G'day, Ross Fowler, Mayor of Penrith. Council values the unique status of the Aboriginal peoples as the original owners and custodians of the lands and waters, including the lands and waters of Penrith City. The health and wellbeing of our communities are a key priority for Penrith City Council. We want Penrith to continue to be a place where everyone has opportunities to be active, eat healthy food, and connect with their local communities. This snapshot of health issues for Penrith communities builds on the information published in the 2018 Penrith Community Profile. It highlights and goes deeper into the emerging health issues and provides more information on our social and physical environment. It also outlines how we can continue to work with other levels of government, local service providers, and the community to support the health of our communities. The Health Snapshot focuses on three important areas for Penrith: why a healthy built environment is so important, mental health and alcohol consumption, and health literacy, including food literacy. In the snapshot, you'll find information about how Penrith is faring right now in relation to these issues and where we can go from here to improve the outcomes for people and places. The case studies included in the snapshot highlight ways council and other services are working in Penrith to foster health and wellbeing. I would like to thank council officers who prepared the health snapshot, council's health partnership officer, Monique Di Marcellia, and council's social planning coordinator, Melissa McSeveny, for their hard work. I'd also like to thank Tom Nance and Western Sydney Community Forum for their support today, and the panel speakers, Rebecca McLean from LikeMind, Dr. Karen Fisher from the local health district, and Monique Desmarchelia from Council's Health and Partnership Officer. The launch of our Health Snapshot is particularly timely. In this new COVID-19 world, it is more important than ever that we work together to support both the physical and mental health of our community. Since the outbreak of the pandemic, we've had increased stress related to job security, social isolation from friends and family, and we've had to adapt to significant changes in the way we live. We know that for some, this has played a toll on their health and well-being. But we've also seen through this time the importance of open space, footpaths for people to stay active. We've overcome social distancing with digital connection, and we've valued the chances to connect in real life all the more. In these unusual times, the Health Snapshot reminds us of what it is that people need to be healthy and well, and by focusing on physical and social environments. Council is dedicated to supporting all communities to be healthy and well now and into the future.
Thank you, Mr. Mayor. I can see that you've tuned in today. Welcome. And as the Mayor said, we Council would really like to thank Western Sydney Community Forum for partnering with us today. And we have Tom Nance here, who is the Manager of Policy and Programs at Western Sydney Community Forum. Tom, would you like to say a few words?
Thank you, Melissa. And as I begin, I first want to start off by acknowledging the traditional custodians of the many lands that we're meeting on today. I myself am personally sitting in Darug land, and I pay my respects to elders on this land and beyond, both past, present and future. I also acknowledge with respect our Aboriginal and Torres Strait Islander friends and colleagues who are joining us today live either via Zoom or via YouTube. So thank you very much, Mr. Mayor, for the welcome and also for the opportunity to partner. We're delighted to partner with Penrith City Council today to help them launch their Health Snapshot and launch it in a way that prior to COVID, we wouldn't have even conceived. So I just wanted to start off by commending the work of Penrith City Council and its team. This is a fantastic paper, a paper which has the opportunity to shape conversations, which is incredibly important. Now, we know at Western Sydney Community Forum and at Penrith City Council as well that mental and physical health is a key issue. It's a key issue for the region and also a key issue for Penrith. Improving the health and wellbeing outcomes of our residents is a priority, as information shows us, like in this report, that a significant proportion of our residents experience poor physical and mental health outcomes. The paper explores some of the key themes that impact on the health of our residents, both in terms of Penrith as an LGA, but also within the region, because Penrith is not dissimilar to other local government areas across Western Sydney. And these themes include healthy built environments, mental health and alcohol consumption, and health literacy, including food literacy, which is incredibly important. Now, as I mentioned, we're in, and I'm sure you've all heard this before, unprecedented times. We have had to rethink the way we do things, rethink the way we engage with communities in the context of the pandemic. And recently we were talking about recovery, but as the incident at the Crossroads Hotel shows, recovery is tenuous. However, as we emerge from the pandemic, whenever that may be, we have the opportunity to reshape how we plan our communities and how we work with our communities. And this document is a perfect catalyst for those conversations. We're big at Western Sydney Community Forum on data-driving decisions in terms of the decisions in how we shape our communities to promote positive health outcomes, but also in terms of the decisions not-for-profit organisations make in terms of how they provide services in a targeted way. We are believers in data-driven decision-making, and papers like the one which will be talked about today and the data that is contained within those make that possible. I'd like to commend Penrith City Council and the team in terms of their approach to this paper, not only looking at the data, but also sourcing data through surveys from their residents to give it that local flavour, as well as providing case studies of different approaches and different information that is of interest and adds richness to the report. As I said earlier, this report is a catalyst for conversation. It provides us with the opportunity to shape policy and the communities we work with. And we at Western Sydney Community Forum are delighted to be partnering with Penrith City Council to help them launch their Health Snapshot. That's about all from me. I'm sure you're going to hear from Melissa as well as some fantastic panelists today. So enjoy your day, have fun, and happy reading.
Thanks, Tom. It certainly is difficult to plan things at the moment when we don't know when the recovery phase will be. But as we know, it's important to be poised for that recovery, but also have this data available to know which communities are more vulnerable at the moment and where we can deliver services. I'm just going to run through a quick presentation now to give people an idea of what to expect in the presentation. In the snapshot. And I'll just share my screen. There we go. So in 2018, Council developed our community profile, providing an overview of the demographics and social issues across the city. And we had quite a lot of health data, and we explored some of the issues in the community profile, but we really wanted to delve deeper and give some more information that we had available to us to inform other local services and support people service planning in the area. So this presentation is just a brief overview of what we can find in the Health Snapshot, which, as the Mayor and Tom mentioned, we really wanted to highlight that our physical and social environments have a huge effect on the way that we live and how healthy we can be. Sometimes, no matter how hard an individual tries to change their health outcomes, if the environment around them doesn't give them opportunities to improve their health, that change isn't supported. So all of us here today have a responsibility or a role to play in providing direct services or advocating for better built environments, working with communities, creating opportunities and influencing outcomes related to health. The key areas in the snapshot are around healthy built environments, mental health with a focus on alcohol consumption, and health literacy. And we were able to use this opportunity to publish some information that hasn't been published before. We surveyed residents across 2 suburbs last year, and we now have that local data to build from, which is great. So in line with the UNSW framework for healthy built environments, Council considers the 3 elements to be social connection, opportunities to be active, and access to healthy eating. And in the 2019 survey of residents across 2 suburbs, we had some interesting findings in relation to those 3 components. So in relation to social connection, what was really interesting was that the majority of respondents said that they felt a strong connection to their community, but only a minority of them were actually participating in any community activities. So what's of interest there is for us to be having more conversations around what people are doing to socially connect at the moment and in usual times, and what we can do to build on that and support that to increase social connection and opportunities for social connection and build that social connection, reduce social isolation for residents. In relation to being active, one of the interesting findings was that people felt quite safe to be out during the daytime being active, but during the nighttime, there was some residents who said that they didn't feel safe being out. So that perception of safety is a really important consideration when we're planning any active transport or public transport even for residents, and improving health outcomes for people. In relation to healthy eating, one of the interesting reports that came back was that the majority of respondents thought that healthier food was more expensive than unhealthy food, which is quite a common misconception. We know that cooking a home-cooked meal with fresh ingredients is often cheaper than takeaway meals, and it's also much healthier. So we think that it's possible that people's idea of what's healthy could be misinformed by marketing around low-carb foods and paleo diets and those sorts of fad foods. Or it could be also contributed to by the fact that when healthy food isn't readily available, the prices are driven up in those local neighbourhood centres. So food literacy is an issue that we could be supporting residents with into the future. Onto mental health. We know that mental health has never been a more relevant topic to talk about than at the moment. We know from a recent survey that Council's done with local service providers that mental health is a rising issue in the LGA. It's coming up as a new issue for residents and is also increasing for residents who had existing mental health issues. And we know that during the pandemic, there's been a lot of anxiety around financial security and social isolation. And having the data around who's more vulnerable to those things during the pandemic is a good way to start talking about where we need to deliver services to address those issues. During the pandemic, however, there has been those silver linings as well and some learnings around the importance of open space for people to be active. We know more people have been out using footpaths and parks and open spaces where they can be active while the gyms have been closed and while people have been working from home, they've had more time to do those things. So it's really highlighted the importance of those things to everybody. It's also highlighted the importance of the ability for people to be digitally connected as well. So that digital literacy is another area to focus on when we're talking about addressing social isolation. When talking about mental health, we also looked at alcohol consumption in the Penrith City, and we can see that it's definitely an issue. If we have a look at this graph here, the black dots are representative of the populations in each of those LGAs, and the orange column is the number of alcohol-related assaults that are happening in those LGAs. We can see for most places that the orange column is not quite as high as the population number. And in Penrith, we can see that per capita, the number of assaults is significant compared to other areas. And this is an issue that could be looked into and addressed, and we'll speak soon to the panel about those issues. So we know that alcohol changes the way that your body and brain functions, and it can contribute to mental health issues, and people with mental health issues can also be more susceptible to alcohol addiction. Across Penrith City, it's only a minority of people who are drinking at risky levels and a minority of people who are involved in these alcohol-related assaults. But it is an issue that needs to be addressed in the area and something that we can discuss and look into. In terms of health literacy, I've got the definitions there around what health literacy is and what food literacy is. And I think the majority of people here today will have some understanding of those already. But both health literacy and food literacy are dependent on a person's access to health education and the environment that they live and work in. In Penrith, we have about the same level of fruit and vegetable consumption as New South Wales as a whole, but there was some interesting results when we looked at fast food outlets in relation to schools across these two suburbs that we were looking at last year. Evidence shows that there's strong links between obesity in children and adolescents and the proximity of fast food stores to schools. And in especially one of the suburbs that we looked at, there was every single school was within 1 kilometre of a fast food outlet, which makes it very difficult for parents and carers who want their children to be eating healthily. And it also normalises that high availability of calorie dense but nutritionally low food. So I think what we can work towards and what we have been working towards is ensuring that people have access to healthy food options and increasing that availability of fresh, healthy food for people who may not have it. And that's exactly what has been happening across the LGA. And you can see in the snapshot, we've got a range of case studies. These are 2 examples of the case studies we're showing. One of them is the Village Cafe, which I'm sure a lot of people know about. It's a well-loved project in Penrith. It's an innovative project empowering people to improve their physical and mental health, well-being and happiness. It's a pop-up cafe operating in North St Mary's, Kingswood and Llandialo. And residents have the opportunity for free coffee, social connection and informal access with the health services around them. With also some health education and promotion happening while they're there. Feedback from participants at all the village cafes has been overwhelmingly positive, showing how successful the project is in really improving people's well-being. One of the other case studies is the Food Ready project. So Food Ready is a 6-week health education and cooking program that's been developed by the Red Cross. It targets people who may not have access to or confidence in cooking with fresh foods in their home. It focuses on offering free, simple recipes and tips that the participants and their families can use in their own homes. Pre-COVID, we were doing these workshops face-to-face in some kitchens across the LGA. Post-COVID, we've actually run some online with Zoom, and that's been quite successful as well. So it's an opportunity for the participants to not only learn about food and cooking and some health information, but also social connection with the other participants as well. So to download the Health Snapshot, this is where it's available on Council's website at penrith.newsouthwales.gov.au, and it's under Documents and Resources. So everybody can head onto there and download their copy. And I'd really like to thank the people who've been involved in developing the snapshot, especially Monique de Michelia, as the Mayor mentioned, but also Jenny Pollard, who's supported the project and been able to help us in delivering it, which is great. Our hope at Council is that the document can be used by local services and other levels of government to open conversations and possible collaborations in projects, to build on some of the success of the projects that have been running, or the possibility of new projects to be addressing health outcomes in the LGA. Okay, I'll now introduce the panel that will be speaking today. We're very lucky to have some local health experts come and discuss some of these issues. We've got Dr. Karen Fisher, who is the Clinical Director of Drug and Alcohol at Nepean Blue Mountains Local Health District. Welcome, Karen. Thank you. We've got Rebecca McLean, who's the Service Manager at LikeMind for the district. And Monique de Michelia, who's here from Council. She's Council's Health Partnership Officer. Thanks for coming along, guys. It's great to have your expertise on board to discuss some of these issues. We might go around to just have a quick response from each of you around what you see as the emerging health issues in the LGA at the moment. Karen, did you want to go first?
I get the lucky first. Firstly, thank you so much for such a fantastic snapshot. What's brilliant about this data is it actually takes a local flavour to looking at some of the things that have become huge in epidemiology, the social determinants of health and how everything shifts. One of the things the pandemic's certainly shown is that if you don't have a healthy environment and if you don't have a healthy society, when you have stress, it's almost like fault lines. It's almost as if you get a massive earthquake that then happens that renders everything we've done invisible. For us, within our service, knowing you've got a nearly 31% rate of people drinking hazardously within the local area, matched with a 1 in 5 hospital admission being complicated by alcohol at our own Nepean hospital, gives you a real indication that this is going to be something that we need to watch in the future. And alcohol, like many of the things we introduce into our health, is actually something that's a wicked problem. The minute we intervene in that space, the minute we tell people don't drink daily, they'll begin to binge. So I think that it plays onto every aspect of the actual report that you've made, plays onto how safe you're going to feel at nighttime, plays onto the level of assaults that are going to happen, absolutely has an impact on your food literacy, because there's nothing like a hangover to make a McDonald's burger seem like a really viable option. And it's the exhaustion that people feel. And I'm sure that others around the panel will be saying exactly the same thing. But for us, during this time, we've seen a really marked increase in alcohol use. And when you're thinking that this was all based on data that you collected in 2018-19, you'd have to look at 2020 and think what we'd be looking at is something even more problematic.
Thanks, Karen. Yeah, that's interesting to know that, there's quite possibly changes since the data we collected during COVID, and it would be interesting to explore that a bit further in a minute. Rebecca, what would you say from your field of work would be the emerging issues in Penrith at the moment?
Yeah, thank you. And building on from what Dr. Fisher just mentioned there, is that certainly looking at the data from 2018 to 2019 and comparing that to where we sit now in 2020 with the onset of COVID-19, is that we've certainly seen some changes around the levels of isolation, and certainly in terms of people presenting, seeking support with quite significant loss of role and loss of purpose, which impacts their identity, their sense of self-worth, and then leads on to concerns around higher levels of alcohol consumption, the onset of mental health concerns as well. So I think it's a really lovely snapshot that you've got there that presents a holistic picture, because that's what we see in the community is people presenting with concerns across a whole range of very complex issues that play into impact what we see as the end services providing support. I think the change as well to people's structure and routine. We know that people are self-isolating, are working from home. A lot of leisure activities have been shut down, but also people have kids home from school trying to work and parent, and lots of changes to role and purpose across the sector. So for us, we're seeing a doubling of presentations for people seeking support from April to now. Referrals to Penrith LikeMind have doubled. So we certainly see that people are reaching out and seeking support for their mental health. And then we see the importance of having options for them to interact with things in the community that keep them healthy and help them stay well.
Great, thanks. I'll just remind everyone that all the attendees, that if you wanted to jump in to ask a question, do so at any time with the Q&A function or raise your hand, and we can get to you. Monique, now you've developed the majority of the Health Snapshot and highlighted these issues. Is there anything that you wanted to add or highlight around what you see as the emerging issues across the city at the moment?
And I think, again, to build on the current situation, there's two main issues, I think. So the first one is the density of fast food outlets in our city. And almost related to that, I think, is there's always been an increase, or there's always been a need for emergency food relief, but this has been even more apparent in recent months. And that's what we're hearing from a range of providers, that there's new people needing those services. And so, yeah, the people are struggling with job loss and quarantine and isolation. So I think the emergency food relief and access to fresh food are particularly relevant issues at the moment.
Great, thanks. So you've all covered quite a range of issues, which is interesting. Can you each talk about how would you use data usually in your role around planning services or addressing health issues in the areas that you work in? Rebecca, I might jump to you to go first.
Yeah, so I think data is our friend a lot of the time. It helps us to understand what's happening in the community around us, and certainly data generally tells us a story. It certainly is only one piece of the puzzle when we look at service planning and service delivery, but it's a really important piece of the puzzle. And certainly for us, something like the snapshot gives us an idea of what's happening across our community. I'm sure everyone on the panel would agree that we've got some really rich data from the people that we see in our services, but we know that we see a very small piece of the population. We know that there's a lot of people in the community who would like support but don't reach out for a number of reasons. And that data then that you have is really important for us in being able to make our services as responsive and adaptive as possible to meet the needs of the community.
Great. And Karen, how would you be using data in planning services, and how would you suggest others who are listening could possibly use the snapshot to address some of the issues in the city?
Building on from what Rebecca says, I think that in health, one of the big moves to ensure equity is to know your data. So you can get some very big data sets that we're all very familiar with using, and they're numbers in the thousands, in the millions, the sort of stuff that goes on globally, then nationally, then at a state level. What's difficult is to ensure that you get equity for the people you're representing. And what your health snapshot allows us to do is actually say, look, we've got some unique problems to this region. One of the lovely things that it highlighted in a fairly horrible way, I guess, is the difference in drinking between Western Sydney and us. So you've got a very similar sort of population. People tend to think all the Western suburbs past Parramatta are uniform. When you're crunching down to what you've actually found in the local area, you've got division across the suburbs, you've got division across the age groups, you've got division across the age-matched cohort that's usually put in those big data sets within the state. So for us, it's around now planning, hey, we've got a massive increase in alcohol, even though the media may say to you it's all methamphetamine, it's all opioids. Actually, it's not. It's the stuff that's hidden in plain sight. It's the alcohol within our area, matched with fast food, matched with social isolation, matched with loneliness, that's going to actually drive planning for us over the next 10 years. We've begun studying our own little cohort here at the service. Obviously, we see the very pointy end of dependency and addiction, But what we're beginning to see are really catastrophic harms by the time someone presents. So for us to use this data to say we need to get in much earlier and build a responsive service in that early intervention and upstream state is probably the big benefit that we're going to find within that snapshot.
Great, thanks. And Monique, how would you usually use data or recommend that listeners be using data such as that in a snapshot to improve health outcomes?
So I think, as you mentioned, that the data that we've used in this snapshot, some of it is local data, and I think that's quite unique for some of the work that we do. So yeah, to me, that is a real positive of the snapshot, is that services can look to some of that information and have that local data. And there is, I say this with some hesitation, but there is a possibility that we could build on that data in the future and add to it. Yeah
Definitely. So obviously we've mentioned that conditions at the moment are a little bit different for people in their lives than it was when we collected this data, and it would be really interesting to see more current data, but we know it's not available at the moment. How can we be using information from pre-COVID to be addressing issues during COVID? Monique, did you want to maybe elaborate on how you think that that health information that was gathered but pre-COVID can be helping people at the moment?
Well, that's a curly one. So I think the data that has been collected pre-COVID, I think, is certainly going to be relevant for the post-COVID environment. And I think it's a matter of how we look at it that will determine the interpretation in the post-COVID environment. And I'm just thinking of the emergency food relief and access to food. We still know that there's people who aren't getting the food that they normally would in pre-COVID times. Village cafes are an example where we've had to change things in the village cafe, so we're not able to offer those same fruit and vegetable boxes that we've done. So yeah, we've definitely received feedback that that's something that's still an issue. So I think we can not so much assume, but gather the information, continue to gather that information from the community.
Thanks. And the other panel members, is there a way that you can talk about how we can use that pre-COVID data to inform services at the moment?
Yeah, definitely. I think in one way, it's given us a bit of a baseline of something to compare to, which is really lovely. Often we don't have a baseline to see what the impact of COVID has been. So that's something that I think is a big positive. We can compare what things are like in 2021 to where they were in 2018, 2019, which is really lovely to see how we're tracking. But I think it also gives us an opportunity to think about what was going well in the community prior to COVID, what were the things that were highly valued by the community and what they wanted to see more of, and then think of how we can be creative and innovative in providing that in our new post-COVID world. I think coming from a mental health perspective, we talk a lot about recovery and mental health as being non-linear and person-centered, and that it's not about getting back to where someone was before, it's about having a meaningful quality of life. And I think that's a little bit similar to where we are now in our COVID recovery planning, is that it's non-linear. You've seen that we've had some forward steps and some backward steps, and that we probably will never return to a pre-COVID way of living. But that doesn't mean that we can't have a fantastic quality of life and be really creative in the way that we do that. And I think using that data then is meaningful for us to see what did the community value and how can we now be creative in providing that for the community.
Thanks. And I think it's just to highlight, you were talking about, working with the community and finding with them what's working well, and those collaborative projects with the community are really important. Karen, did you want to add anything add all to that?
I just say that one of the wonderful things about it is going to be able to let us look at how loneliness tracks in this particular environment. So one of the issues around using alcohol is that it's a fantastic anesthetic. So when you actually feel any source of pain, it's a great one. We used to do surgery making you drunk. So it's not that it's unknown. It's something that we've always lived with as a species. What's going to be fascinating is whether or not some of the projects that we've actually developed will stand the test of reducing loneliness in the post-COVID environment, or in a time where things are incredibly uncertain. I think one of the things around digital technology to look at is it's reaching some people that are familiar with it, but we've got an aging population that are drinking that we see through the hospital. Have they really coped with the sorts of activities that we've designed that are all very technologically based, which may not be their literacy strong point? So for us, it's around how do we actually adapt the things that we've all thought are working for our peers and for our colleagues. Maybe they're not for those sort of nuanced cohorts that are actually captured in the snapshot that are showing us a little difference that we need to respond to. And it's stuff like the Village Cafe. If that changes, what does that do to a person? How does it actually manage to be counted in some of the other designs that we come up with? So yes, webinars are great, but most of our patients struggle to actually keep a mobile phone that can keep the data going, to be able to download the sorts of things that are fantastic. So I think that one of the things that's really very, very clear in that snapshot is that we've got a massive equity issue and we need to be on top of it. Yeah,
definitely. We've got quite a few questions coming in from the audience at the moment. The first one, I think, from an anonymous asker, Monique, I think might be your area of expertise. They're asking, how do you think technology can help improve our built environment and gaining data on that?
There's so much technology available, isn't there, with regard to changing the way that we build things. So yeah, I think it's got a huge role to play in how we move forward in creating healthier built environments. And I think also it's also about asking us to change the environment rather than asking us to change the people. So looking at rather than changing the behaviour of someone, changing the environment. I think there's lots of value in using technology to look at that.
Yeah, I keep hearing of all sorts of organisations having data sets now from people's mobile phones. It's you privatise, but they can access now where people are visiting in different cities at different times of the day, and then we could look into things like why aren't they visiting other particular places. And as with all data, though, it often raises more questions to investigate, looking for that story behind the data, because the numbers don't always tell the story. And as we've done in the Health Snapshot, we've got some of that data and the numbers, but also some of those case studies around the projects, which are often evaluated with anecdotal evidence as well. And it's about having those complementary data sets to show what's going on for people.
And I think too that community collaboration in order to understand the stories behind that data, so they go hand in hand.
Yeah, great. For the other panel members who didn't contribute to writing the snapshot, we've got a question from one of the audience members. Were there any insights or information that came out in the snapshot that you weren't expecting? Anything that was surprising to you? And given any surprises that you might have had, or anything that you found of interest, has it sparked any ideas about how things might could be done differently, or how you might address those things? Karen, do you want to go? Did you want to have a go at that one?
So yeah, for us, one of the really interesting aspects was the assaults. So it's the thing that we probably are really reluctant to look at, because we're all about destigmatizing, we're all about not including that. We absolutely don't want to play on that link necessarily as health providers. but we're getting a very strong indication that domestic violence is a huge concern. Some of the screening questions that we've had have always been based on a pre-COVID environment. Now, when you're seeing a trend within a snapshot that's saying, look, this is very different to the rest of the surrounding environment, very different to Western Sydney, it will make us continue that journey that we've begun, which is how are we going to actually adjust our screeners and adjust our interrogation to include what we know exists. Because crime and assaults live in a different world to health statistics. You, in marrying the two, have absolutely given us an indication that we need to craft a different response when we're assessing people. And it's not to add to prejudice, it's not to add to stigma, but it is to work with talking to a person about how catastrophic alcohol's become in their life. Because it often leads to people for the first time being involved in behaviours that they never would be involved in if they were sober or if they weren't using that terrible anaesthetic that completely disinhibits you. So that I found fascinating.
I guess it's a great opportunity to be at council where, as not a direct health service provider, we're able to look at the crossover between health and social outcomes. And the reason we included that data is because we were thinking, what are the social effects that this that alcohol consumption has in our community? And Rebecca, was there anything in the snapshot that you were surprised by or that stood out?
I think I was a little bit surprised as how well it lined up with what we see at LikeMind. And I think we're probably in a nice position because we work across two different health districts. So we have one site in Penrith and one site in Seven Hills. So it does give us an opportunity to compare the data that we see across the two sites as well. And certainly your snapshot lined up very well with what we see as the presenting concerns coming through. We do collect data on sort of myriad of presenting concerns that people come through with. And interestingly, we find, I think in our most recent quarter, about 90% of people presenting to LikeMind have more than 2 presenting concerns when they come in. So we don't often see people coming in with just one concern. They come in the context of having a lot happening in their life when they're presenting for support, which I think really lines up well with what you've demonstrated in the snapshot, that these things are not happening in isolation, that there are many social determinants of health and the impact that has across someone's health and overall well-being as well. So I think that actually lined up really well for us.
Okay, great. Thanks. So we've identified quite a few issues in the snapshot, and then you've all raised some other issues of importance as well around health outcomes across the city. We've talked about mental health support, food service, loneliness. And we've got some case studies in the snapshot around that are improving some of those health outcomes in the city. Karen and Rebecca and Monique, are there any other project models that you've seen around that you'd like to see either expanded in Penrith or come to Penrith for the first time that would address some of those emerging issues we've talked about?
I think I'll jump straight in there. I think something that we've seen in Penrith, which has started in Penrith, and I'll give a bit of a plug, I'm sure it gets a plug everywhere where there's a group of people together, but those sort of grassroots local initiatives such as the Penrith Men's Walk and Talk, I think those sort of local initiatives, local grassroots, local flavour, I think that's really important for being able to address some of these concerns across the community and talking to the community then around what are those particular things that they'd like. But I think one of the most important things that we've seen at LikeMind and one of the highest uptake of things have been things that start at a local level, that have that local flavour and meet the needs of the community, because every community is so unique. I think as well, the Village Cafe, I'm sure Monique would know as well. So we have a community development coordinator for LikeMind. His name is Billy. He's definitely on here today. So Billy has a wonderful hand at most community events across the two areas that we work in. And he would definitely attest to the fact that the local initiatives just gain the most traction.
Yeah. Monique or Karen, do you want to jump in?
I was going to add the collaboration between the different partners, and I've seen that in a number of different situations. So the consortium that LikeMind have, I think that's a fantastic model. And also to give the Village Cafe another plug, the partnerships that we have through Village Cafe, we've seen some fantastic relationships and engagement with the community as a result of the partnerships with our services. So I think that's, together with those ground roots projects, I think the partnerships with the services is a great model.
Yeah.
Can I say that one of the things that we haven't been quick to uptake is the notion of social prescribing, which has had very good traction internationally, and it would be fantastic to use the social prescribing idea, which is that a health professional actually prescribes the different sorts of social interactions that are available for you and supports you reaching them, rather than doctors always reaching for a script pad that only prescribes a pharmacotherapy. It would be brilliant to say, actually, what I'm saying is you need 6 sessions at the Village Cafe. I'm going to provide some transport. I'm going to ensure that you get that. I'm going to wrap around those sorts of activities, and you're going to come back and tell me how that worked out. Because I think by health becoming more active, to actually say you can prescribe against the negative impacts of the social determinants of health, you'll get a much nicer outcome. And taking Rebecca and Melissa and Monique's point, you're able then to craft the very localized support that's available specifically for that person that may live in Saintly Crescent, that may live in Cranebrook, where they've got challenges around transport, and you're acknowledging those local variations that are having such huge impacts on the way in which health outcomes vary.
I'm not sure if we've got anyone here from the PHN today, the Primary Health Network, but I hear along the grapevine that there might be something like that coming along for GPs to be able to look at lists of services that aren't necessarily traditionally classified as medical services, but more neighbourhood centres and social programs and things like that the doctor can refer people to, which will be great. The Health Snapshot highlights some of those equity issues, and you're saying, Karen, and we know that there is a lot of difference across suburbs and across different cohorts in the community. I was just wondering if any of you could talk about what we could be doing to address those equity issues, especially at the moment when we're relying on technology more for people to be connected to services and to each other, and the importance of that. Would anyone like to speak to that point? That was also a comment from the audience that that technology, for example, is a huge thing, but not everyone has access to it at the moment, and not everyone has access to the opportunities they need to be healthy in other ways either.
Absolutely. I think at the moment, technology is a wonderful double-edged sword for us. It's one of our biggest blessings and also one of our biggest barriers for people being able to equitably access services across the board. Definitely in our new way of delivering services, where lots of services are delivered online, I think that across the community, we will start to look for ways for people to access sort of e-hubs, where even if they don't have their own technology, they'll be able to come in and be able to access or have free access to technology to be able to tap into a range of different supports that are delivered online. But I think going beyond just delivering an online forum is being able to meet the needs of the community. And I think initiatives like the Village Cafe or the different sort of tenants projects that we've had running before, where it's people going out into the community to have that non-confrontational and a informal way of connecting with the community and having opportunities for them to then interface and gather information in a real-time, face-to-face, person-centered, tailored information for you approach. I think that's really important for people being able to access services. It's very daunting to reach out for the first time and put your hand up and say, actually, I'm really struggling, or, actually, Dr. Fisher, I think my alcohol's a problem and I need to talk to someone about it. That's really scary to knock on the front door of a health service and come in. I think networking in the community and delivering that information gives people an opportunity to reflect and think, actually, this could be a problem, and here's where I can go for help, and here's the smorgasbord of choice that I have available to then come in and be it, I'll go to that cafe where they are to have a chat with someone, or I'll link informally, or I will do it from an e-hub, or I'll do it from my lounge room if I'm able. So giving people, I think, a myriad of choices is really important as we move forward.
Definitely. And I think that's in line with some of the comments that Monique was making before about, rather than trying to change people's behaviour, it's about changing the environment that they're in and the opportunities for access to information and programs for them. You know, with digital literacy, for example, there's a, you know, proportion of people who aren't digitally literate and would like to be, and then there's a proportion of people who are not interested. It doesn't add benefit to their lives. That's their perception, that it's not going to add anything to their life, and they're not interested in, you know, at the age of 80 or 90 to learn about technology and the ways they can connect online, and they'd rather face-to-face service. So we need to be delivering in both ways, or in a multitude of ways, as you said. Did Monique or Karen, did you want to add anything around that issue of equity in terms of addressing that for people?
It's more of a thought bubble at this stage. As Rebecca was just talking, I was thinking that our neighbourhood centres, I think, have a role to play now, but I think they could have a further role in the future. Just thinking about some of those digital possibilities for some members of our community, and how our neighbourhood centres could be a big part of that. I know a lot of them do a lot of groups, but I think there could be more opportunities there.
Okay.
I also add that we've got an emerging CALD population, so a culturally and linguistically diverse population that actually needs special support and consideration in this space. And we also have a huge amount of hidden illiteracy just from basic reading and writing. And so you're not only talking about the bridge too far from a demographic point of view, as Rebecca highlighted, sometimes you're talking about a bridge too far because you don't want to reveal that basic difficulty you're having with negotiating English or negotiating reading and writing. We have, when we began to rule it out, not in, within the ward, we found lots of people that would say to us, I know you gave me lots of pamphlets, but actually I struggle to read that. So for them to actually bounce towards a digital environment is an even larger bridge to cross. So perhaps starting from understanding each person and where they're at and what they actually work with. Some people are incredible visual learners. Some people have a completely different way of engaging. For some people, this is just too confronting. So taking the point that all the panelists are making, that we need a myriad of choices, and perhaps not presuming as much as we sometimes do in terms of our norm, and moving beyond that to understand what each person's starting point is and building around that to their strengths.
Yeah, that's right. And speaking of working to people's strengths, we could reframe that question about disadvantage in different areas and look at the strengths that are there that can be built on. As we all know, working in communities across Penrith, sometimes the most disadvantaged communities are the most resilient in a lot of ways as well. And there's always strengths there that can be built on and supported when we're working with the community to find out what those are and how we can support what they're doing already as well. There was, I mentioned the PHN before and the social prescribing, and Liz Murphy has written from the PHN that if anyone's interested in looking at the pilot in the Hawkesbury, the Nepean Blue Mountains PHN website has, in relation to older people's health, a social connectedness project. So that's a pilot in the Hawkesbury at the moment that I believe they're looking to roll out to other areas afterwards as well. We're getting close to the finish, and I'd just like to ask if any of the panel members have some closing remarks around anything that we've touched on today around health outcomes in the city, how we can be working with the community to address those, the strengths that can be built on, what's working well at the moment, where to from here. Any closing remarks on what people, we've got a huge bunch of people listening. So maybe some takeaway actions from them and what they can be doing towards health outcomes in the city. Karen, did you want to go first?
I'd say it's an amazing document, and it's fantastic that so many people have actually registered to be involved in this webinar. So huge thanks to everyone for giving up their time. From our point of view, look, we're open. I know it doesn't seem like it. Sometimes our phone lines are awful, but please feel free to come and visit us if you want to learn about any aspects of how drug and alcohol use is affecting you or your community. We're always willing to listen. I've always thought there's a fantastic TED talk where an artist actually wraps up a building and said, let's reimagine how it would be. It would be brilliant for us to take this as a virtual webinar to say, this is the beginning. We've got a snapshot that says, let's reimagine how we're doing work. We're really open. Come and talk to us. We're all in it together.
That's right. Rebecca?
Yeah, absolutely. I think just picking up on what Dr. Fisher said then is that we are all in it together. I think if there's anyone listening who you would like to reach out and talk about what's happening for you personally, please do so. And if there's any organisations listening who think, wow, actually, I'd like to partner and look at doing something local for the community, we would love that as well. So our community development coordinator is quite possibly one of the most visible faces of LikeMind, and probably one of our very busy employees. He's all over the place all of the time, but we're always really interested in partnering with local initiatives. If anyone has any fantastic ideas, your thoughts, your community, we're all about keeping it local. And just a big thank you to everyone for giving up your time, as Dr. Fisher said, and to the council. I think Penrith Council has been incredibly proactive throughout the COVID-19 pandemic, but prior to that as well, it's a pleasure to partner with you as always. So thank you very much.
Thank you. Monique?
I would just like to say we have a snapshot, yay! And I look forward to continuing conversations with the community and also with our stakeholders with the snapshot in my hot little hand, albeit maybe virtually, and yeah, continuing a conversation about how we can work together. Thanks very much, everyone.
Thanks. And I'd just like to acknowledge that we have some great projects running with the LHD and with LikeMind and a range of other organisations, which are great. We've got so many success stories from projects across Penrith. Monique, thank you again for all your work developing the snapshot. And a reminder to everyone watching that it's available on Council's website under resources and documents, and that today's webinar will be posted on Western Sydney Community Forum's YouTube channel. So thank you everyone, and thank you Western Sydney Community Forum for partnering with us today, and thank you to all the panel members for a great conversation. It was really interesting. Thanks everyone. Bye.